Good evening, everybody, and welcome. I'm Reverend Eric Mueller. Welcome to those of you joining us online. I think there's more of you out there than there are in the room, but that's okay. So I'm Reverend Eric Mueller of All In United Church of Christ and Music Project of the Eastern Association and St. Thomas United Church of Christ and the St. Louis Association. And on behalf of Eastern Social Justice Committee, I welcome you to this program. And thank you so much for representatives from our CHHSM agencies for joining us this evening and for JMO for agreeing to moderate this discussion. One thing to keep in mind as we listen tonight, I think, is to recognize that none of us can do everything, right? But all of us can do something. And so to pay close attention to find what really speaks to you and jump in where you can, either as an individual or as a congregation. So that said, I'm going to invite Reverend Tracy Harris, our host pastor, to give her greetings.
Welcome to those that are with us in person and those that are watching from home or wherever you are. And thank you, CHHSM partners. We appreciate all of you. And we do need to hear your voices. So welcome. We're glad you're here. And we're glad you're here to do this job. And we welcome you to Friedens here in St. Charles. And we want you to know that we do have cookies downstairs after this too. So you can have a reward for coming out on a chilly, dark night. It's always windy up here and we're sorry. But anyway, bathrooms are down the hall if you need it. There's also an elevator to take you to the lower level if you need that as well. So if there are no other questions, I will let you all get started. Thank you.
And I'm Jeanette Mott Oxford, known by the nickname JMO. I'm a member of Epiphany United Church of Christ in St. Louis City and a graduate of Eden Theological Seminary and a real fan of the Council of Health and Human Service Ministries, with whom I've worked for many, many years, having been in public policy work in Missouri for 40 years. So tonight I am going to ask a few questions, and this is a do-it-yourself kit of a panel, and that I wasn't provided like biographies to read to all of you. So I'm going to have you introduce yourselves and to tell us a little bit about your organizations as the first thing to start. And we'll start with the person to my left.
Okay. Hi, my name is Dr. Denise Buck. I am the CEO of IFM Community Medicine. I am also a lifelong UCCer. I'm a member at Hope UCC down in St. Louis City and have been my entire life, was baptized, confirmed, married there, as were my parents. So I'm missing our worship ministry team meeting tonight to be here to talk with all of you. So IFM Community Medicine started 25 years ago. We take kind of a unique approach to healthcare. We are not a federally qualified healthcare center, which means we do not get any money directly from the government. But we partner with other agencies to get healthcare to the people that need it the most. We work with a lot of shelters, youth in need programs. We're at St. Louis Crisis Nursery Covenant House, Epworth Drop-In Center, Lydia's House, Every Child's Hope, and have clinics on site there where their clients are able to get healthcare free of charge without having to worry about, someone escaping domestic violence. How do I get my kids their vaccines or get to the doctor if I'm afraid to go out to where I used to because my abuser might find me? We have a very welcoming clinic right there on site. They're able to get that care they need. We also have a couple community clinics in the area. We have one in Bridgeton that was started with some money out of the settlement from the landfill to try to help get healthcare to those who may have been affected along Coldwater Creek and from the radiation exposure in that region. We try to go in and listen to our partners. We don't have a cookie cutter, one size fits all for our clinics. So for example, in Bridgeton, we went into Pattonville school districts and they said, we really need people who speak Spanish. We have such a large percentage of our students that are Spanish speaking. We hired a community health worker that was bilingual, and now 50% of the patients that we see there are bilingual, and a lot of undocumented even immigrants who are legally here and are still afraid to go out. So that's a little bit about IFM.
My name's Alina Schmidt, and I'm with Embrace Living Communities. We provide affordable housing.
There you
go. Yes, we provide affordable housing. We have 30+ buildings, and something we really work on is providing social services and programs within that building. And I am the social service worker out from the Kansas City buildings. So.
Good evening. My name is Darlene Soul, and I'm with Unleashing Potential. And we work to help youth in the work that we do. We've been around since 1913, and our mission is to close the opportunity gap for all children, regardless of race, zip code, economic circumstance. And we have done it through early childhood education, out of school time programming, including summer program and parent engagement. Most recently, as of August 29th, which is something I'm sure we'll speak about, we have had to pause services in our early child care center at Caroline Mission due to the external economic circumstances. So we are doing some significant revisioning. We have been around for 112 years. We made it through the Depression. We've made it through decades of ups and downs, and we have a very bright future and are looking at different ways to serve the community, particularly since St. Louis City is still grappling with the results of the tornado in May. Yeah. And there are many, many gaps that we can utilize our services to help the children and families in the St. Louis region. Our out of school time program is in Ferguson Florissant, University City, and a charter school called Atlas in the city. And we're probably serving about 500-600 children year round, even without the early child care center. So I look forward to the discussion.
Good evening, everyone. My name is Lisa Key, and I'm the Chief Development Officer at Emmaus Homes. Like Darlene, we've been around a long time. I think we've got you beat. We're over 130 years old. I, too, am a lifelong UCC member, as is my family. We're from Michigan and born and raised, married, all the things. As many of you know, Emmaus was founded by the precursor to the United Church of Christ in Marthasville. For years, we operated with 2 large campuses, very institutional-like settings for the clients that we serve. For those of you who don't know us, I'm sorry, I'm jumping around a bit. Emmaus provides services to adults that are developmentally disabled. We have about 200 clients that we serve. We do one thing, and we do it really, really well, right? We provide residential service and support to individuals, adults with developmental disabilities that need it. We don't have campuses anymore. We transitioned all of our clients off of campuses to the community in the last 10 years. We now have 70 homes throughout the St. Louis metropolitan area. Our clients live in these homes, and they're their homes. We simply provide the services that they need. Like Darlene mentioned, we've survived it all, right? Depression, the Great Depression, funding issues from the state and federal government sources. We're now dealing with everybody else, the impact of the government shutdown and SNAP and how that impacts the folks that we serve. We're really blessed to be partners with the UCC and with CHHSM, and I look forward to this conversation this evening as well. So thank you for inviting me.
Good evening. I'm Brenda Booth. I am the Executive Director at Isaiah 58 Ministries, which is located in South St. Louis City. We have been a ministry there for 57 years, so not as long as you guys, but you know, got to start somewhere. Anyway, so I have been there 19 years. We have grown tremendously since I have been there. Our primary ministry is for food, reaching people who are food insecure, providing them with food resources. We also have a clothing room And we started last year a shower ministry for our unhoused guests. We do some health and wellness classes, things like that, trying to lift up people who have, as Darlene put it, kind of fallen between the gaps or are struggling on a day-to-day basis. So that's what we do. I'm sure we'll get more into detail as the evening goes on, but that's where we are at this point in time.
And do we have a speaker up on the screen?
A couple of chat that I want to share with you all.
Okay.
One was from Reverend Cindy Bump, who says, hello to my dear Chisholm friends, you are always in my heart. Cindy was long paycheck.
Mm-hmm.
And then Jamar Doyle. So hello all, it is so good to see so many friends in the room with fire.
And Jamar, you can ignore my email that was trying to make sure what was happening tonight. So I found out. Eric let me know. All right. So, all right. So thank you for sharing about the important work of your organizations. Public policy is best if we listen to personally impacted people and those who serve personally impacted people. And unfortunately, that did not happen when H.R. 1 was passed back in July by Congress and signed into law by President Trump. It was called the One Big Beautiful Budget Bill, which I think is grossly misnamed as a person who's cared about poverty for a long, long time. The Government Accounting Office, projected that 15 to 17 million people would lose health care, that millions of folks would lose their SNAP because of work hour reporting requirements. People who are desperately poor have trouble with the bureaucracy of reporting things, and Missouri's computer systems are not set to record that accurately either. We have the Family Sport Division uses computers they rely on COBOL. That means they're really, really old. Computers that rely on COBOL are kind of like only fit to be boat anchors. They're not really computers, So we are in desperate trouble as a state, and innocent people will suffer under this law that passed. So we want to hear from you all what has already happened because of H.R. 1, and then maybe also a little bit of what are you bracing for that you think may happen. And let's start in the middle this time. We'll start with Darlene, and then go to your left, and then wrap around down to this end. What do you say?
All right. Well, let's get it started. I'll start with July. And for many of you, you know that the Department of Education was under siege at that particular time. And organizations that serve children in the educational realm really went on a hamster wheel. 1 minute, there was a pause stating that 21st Century is the federal funding for after-school programs. It was all placed on hold on July 1st, and those dollars were to come to the state of Missouri. We had already begun summer programming, and then we were told we weren't going to get any funding. It's already reimbursable, and so then we were scrambling, and we're really just going to have to cut off services. Fortunately, Missouri did do something correct, and there were reserves set aside. So we have funding through June 30 for our after-school programs, but we can't sit idly by. It is likely, I'm not depending on our federal government supporting the Department of Education as they should. So we are moving to empowerment mode to try to educate our families that there will be some sacrifices they need to make in order for working families to have the adequate care in a learning environment, a caring environment that their children need after school and in the summer so they can continue to work. So that is the ups and downs that we go through, and that's probably the most frustrating thing that we are dealing with at the federal level and the state level. Uncertainty from day to day makes it impossible to plan. And what communication do you share with the families that need our services? Because at the end of the day, you just do not know. We're doing a lot of walking by faith and not by sight, but we have to be proactive and make provisions for the future. And that's what my board and staff are preparing to do. It requires right sizing, which is one of the reasons that Caroline Mission has closed its programming. That doesn't mean we won't serve those families. We're just trying to figure out a different way to serve other than direct care, although direct care is critically needed, not just in the state of Missouri, but around the country. But if the funding isn't there so that we can pay teachers as well as help those working families, we're backed into a corner. So we'll figure out a different way to support those families.
Oh, well, I can echo much of what Darlene said. I think we're all probably singing from the same hymnal up here. For us at Emmaus, it's the unknown. Like she mentioned, we're walking by faith and not by sight. The work that we do is critically important, just like every other panel member up here. Our work really right now is focused on advocacy. We need to advocate for the clients that we serve and for the people that serve them, right? We have 200 clients that we serve. We have 700 team members. And we struggle, we fight to pay them a livable wage. And so it's all about us advocating both at the state and the federal level. We also know on the flip side of that, that there's families that need our services, but they don't have the funding from Medicaid in order to access our services. So there's a critical need in the community. It's not uncommon for a family to have a child with a disability, and they raise that child until crisis hits. A parent gets sick, one of them passes away, and then all of a sudden they need services like ours, and it's a scramble to try to get them the funding so that we can provide those services. We worry about a lot of things, right? Our prayers include a lot of things. All of our clients are at the poverty level. Many of them receive food benefits. More than 75% of our clients receive SNAP benefits. That went away, right? And that's going to cost our organization $25,000 a month to cover that gap. So it's a lot. What I know, though, is our commitment to our clients is they're not going to do without. It doesn't matter. Our clients come first, and we have to believe that I don't know, common sense will prevail. Hopefully, the government will open back up, and we'll be able to continue the very important work that we've done for the last 130 years.
Thank you. Yeah. A lot of the same stuff, so I have been at the ministry for almost 20 years. When I started, we had about 400 visits to our ministry a month. For the past 4 years, it has increased by 30% each year. So this year we were serving on average through July, approximately 1,400 visits to the ministry every month, up from 400. 1,400 visits to the ministry. And then the SNAP cuts and requirements happened, and then the government shut down. Last month we had 1,600 visits. That's an increase of 200 people in 1 month. And when you have a line out the door of over 30 people when we first open in the morning, and the need is there, and the hallway, the waiting area is full all day long because the need is really there. People are hungry, and this is very real situation where people are going to go hungry. Children are going to go hungry. People are going to starve if we don't do something. And this is where I call on JMO, our activist, and all of us. We all should be strong, working on advocacy to change the way our policies are handled and get our voices heard by the communities, because nothing is going to change if we don't raise our voice. It is a very real issue. This is not hypothetical. This is not a what if. This is happening right here, right now. People are going hungry. People are going to go without health care. Real people are going to really suffer if we don't make a change quickly. So I'm kind of the mentality of loaves and fishes and trust that there will always be enough, because our guests are first and foremost, and we always provide what we are able to, and it seems that there is always enough. But with the numbers increasing the way they are, it's first time in a long time that I'm questioning how are we going to sustain this. So it's a very real issue right now.
Okay. So HUD Supportive Services places social workers like me and other helping professionals in HUD buildings and HUD housing communities. And we provide resources and referrals and link the individuals we serve with vital resources. And in situations like the shutdown, workers such as myself really help bridge that gap. We are the ones finding donation partners and bringing in food and building these partnerships. And then prior to the bill in the summer being passed, social services, the supportive services for HUD was not in the bill at all and was put back in at the last minute. And so, we are facing a lot of that uncertainty as well. We feel that supportive services in HUD housing is a really critical component to making housing successful and helping bridge that gap, especially when it comes to advocacy and accessing state benefits.
So for us, we don't directly get federal grant money, but what we're seeing, and what I think not a lot of people realize, because other organizations aren't getting money from those government grants, they're now going after some of the grants that we used to be able to get fairly easily. So it is affecting us, even though it's not directly. The other day I was talking to an organization who they used to get federal grants, and when they applied for it, it asked them to sign a pledge that they did not participate in any type of DEI, and they refused to sign it and said, no, thank you, we don't need your money if that's the requirements you're going to place on us. So it's been a struggle, because now that some of those government funding sources aren't there, there's a lot more people needing that grant money and the support from other areas. So that's kind of one of the things that we're concerned about. The other big thing for us is we've always worked with people on Medicare, people who are uninsured or underinsured, to make sure that they can get quality health care where they are. We will bill like for Medicaid if they have it, but the higher and higher percentage of our patients that are uninsured and don't even have the basic medical coverage, that eats more and more into us. The other thing that we just found out, you hear a lot about insurance costs going up. So the big thing that we were just hit with, we have about 26 employees, 20 of whom we insure for their medical benefits at 100%, because we feel that we need to be providing that adequate health care for our employees. And we just found out that there's over a 60% increase in what we are going to have to pay next year just to cover our employees in healthcare for their health coverage. So now it's, do we only pay 80%? Do we have to pull back from our own staff when they're already working for a nonprofit for much less than they probably could get elsewhere? And so that's another way that it's affecting us. So trying to get creative and find new ways to make as much as we can with what we have. We've hired a number of community health workers who work to help our clients find other resources. Food is a big insecurity that we see in the patients we're serving. And so helping them find resources within the community to be able to get those other basic needs as well.
Yeah, it's probably already obvious to you that these folks do not do their work in separate silos, that it's probably real likely that some of the families served at Unleashing Potential also go over to Isaiah 58 to get some food. And a lot of this is because we have not created our public policy based on reality and hearts of compassion. There's been a certain kind of popularity contest and a lot of myths and stereotypes that have shaped how we do public policy. Meet that 30% standard where she only spends 30% of her income on her housing and utilities. So I took her to visit a HUD supported apartment complex today that would cap her rent at 20%. If we can get her into there, that would be a good alternative. But there's such a shortage of affordable housing. Missouri needs 200,000 more units of affordable housing just to serve people at 30% area median income and down. So if we don't look at the realities, like how many people are out there who really can't afford basic human needs, and what are the rules that we've set up, and where do we cut people off? You know, years ago when I worked at RAL, there was a woman who had to quit her job because her child, at that point, we didn't have the 300% standard. Her child had leukemia. She had to leave her job for her child to have health care. And you just shouldn't set rules that way. It's just ridiculous. So that's a little background of what's going on here, is that we really need to have our government programs shaped based on reality and numbers that reflect the true cost of living. And that hasn't been happening. So some of you have already hinted at this, but does anyone want to add anything about how you're navigating the current uncertainty? We wanted to hear some about that tonight. Most of you have mentioned something about it, but is there another thought that occurs to any of you about how you're navigating this period where we don't know? You know, right now, the Senate has voted to reopen the government. The House is not yet. We don't know exactly what's going to happen there. The various things that pass in HR 1 have different dates for when they kick in. And there's lots of projections about how many people will lose what when. So there's a lot of uncertainty. What are you all doing to be ready? Darlene's being very creative. She's already said they're kind of reinventing how to serve folks, and then have closed a center in order to right size. So anybody have anything else they want to tell us about navigating the current uncertainty? Yeah. Start with this.
Yeah.
Okay, that's great.
So one of the things, I mean, we've built a really strong leadership team, and we're constantly, just because of the uncertainty, we're always like, okay, worst case scenario, you know, like we need to plan for this worst possible case. Like if these things happen, how are we still going to be able to provide the services that we are to make sure that we're getting healthcare out to those who are really in need? So we've been a lot more vocal in the community. We've been trying to get our name out there. We always say IFM was one of the best kept secrets in healthcare in St. Louis. For the past 25 years, we're really trying to change that just so that people know who we are and what we're doing. We're working with trying to develop some partnerships with the local hospitals in that, you know, us helping catch these patients who are falling through the cracks of the current healthcare system or keeping them out of your emergency room. So it benefits you to try to help us do that. So we've tried to be creative with some of those sources. And then having, you know, realizing that this is having a major impact on the patients that we serve. So having the community health workers, we do social determinants of health screenings on every single patient that walks in the door. And anything that's identified, whether it's paying for utilities, food insecurity, housing concerns, we have one of our community health workers sit down and go over resources with them and try to connect them and then follow up with them to make sure that they're trying to get those services as well that they're in much need of.
Okay. So during the shutdown, you know, there's no federal HAP payments for housing. And so Embrace Living has been very responsible and proactive in closing that gap. And there has been really no changes to the individuals we serve and what they see in our buildings day in and day out. As far as like navigating the shutdown, I feel like this is something Embrace Living Housing has done very well. We have always provided accurate, non-biased information when we actually have information to give. And so when it comes to SNAP, as an example, I had individual conversations with residents, and not only were we notifying our communities, but we were working one-on-one prior to the Social Security paychecks coming for the majority of the residents we serve. And we're also just bridging the gap, in our buildings as far as like food donations and things like that. And I feel like Embrace Living has really shown there. And then in Missouri, we still have access to LIHEAP, so gas assistance, and we continue to bring in all of those applications and set everything out. And we have approvals coming in. And so since I work as a social service coordinator in 2 buildings, I just like to say that we are scheduled to bring in gas assistance through LIHEAP over $13,000. And these are with individuals who couldn't navigate this without some assistance. And so we create this culture and this environment where they feel comfortable, and we're able to put these resources in their hands and connect them. And so during this gap, we've been able to provide certainty and access to physical resources such as food.
Yeah. And for those that don't know what LIHEAP is, that's the Low Income Home Energy Assistance Program. It's absolutely vital to help people stay warm in the winter. LIHEAP was not refunded, and their federal staff was fired. So it's a time of great uncertainty there. I'm the board president of the Consumers Council of Missouri. We're fighting to make sure LIHEAP is funded and is there. So folks can Google moconsumer.org in order to learn more about the Consumers Council of Missouri and join us in that fight to see that LIHEAP is available for folks, because it's a really important program. Yeah.
I guess the other thing I'd add in regards to how to be proactive is this is the time when we all have to work together.
Mhm.
I think Eric or JMO mentioned that we can't do it all.
Mhm.
And so we don't provide food for our families.
Yeah.
So I need to make sure I'm in contact with Isaiah 58, Operation Food Search, the food bank, and make sure those resources are available for our families. We need to, we're revisioning, and we're focusing on 3 things. How do we reinvent ourselves and serve those families with babies? How do we collaborate with other organizations? And Lisa mentioned advocacy. It is key. We are doers. All of us up here have been doers for decades. Nonprofits have to be advocates now, and that can mean different things for different audiences. For our parents, we're going to start with, are you attending the PTA meetings and showing up for your child? Because if parents show up for their child, guess what? The school districts pay more attention to what the needs of their children are.
Right.
If you're working 2 jobs, you might not have the time, but some adult needs to be there representing their child.
Mhm.
Then it moves to, are you voting?
Mhm.
Are you voting? Our families don't. And we need to educate them in terms of the importance and how it impacts their everyday lives. I am proud to have been in Chisholm for, oh God, how old am I? A very, very long time. We work together. Jamar, you're out there. You need to come to St. Louis. It's time for all of us to get together and strategize. We haven't had one of those meetings in a good while. I'm putting you on blast. But that's important. And then we share ideas and how to help the collective. This is a community of silos. I'm bad. I'm not from here. But that is one of the things that is very evident in the St. Louis region. Everyone wants to do it themselves, and they want to do it all by themselves. This external environment does not allow that for the families that we are all charged and called to serve. So those are the proactive things. They seem, lofty, but if we narrow them down, we can make a difference. Our voices are important, and we need to make sure all of our families understand that their voices are important.
Yeah, I'd like to add some of the things that we are doing at Emmaus to try to move the needle a little bit. We're a $45 million organization. It's on our operating expenses. Again, 700 employees, 200 clients that we serve. In many cases, the clients that we serve don't have any family at all, and so we become their family. And, I think our leadership team has been aware and worried about the current administration and some decisions that have been made. And so they try to get out in front of it by doing a couple of different things. We're trying to diversify our revenue streams. So rather than just relying on the fee for service that we receive for providing care for our clients, we developed 2 new product lines, and one of them is called Adaptive Solutions. So we modify clients' homes so that they can age in place. We're pretty good at that, right? So now we're starting to offer that to the broader community because most of us want to age in place, right? We want to stay at our home. And so we can go in and we can do that service for you. And so that's relatively new, but it's growing. And then also we, because of COVID and how we had to sort of transition how we work and what it looks like how we work, instead of having 100 people in our office every day now, most of our folks are some sort of a hybrid schedule. So we converted unused office space into what we call the learning lab. And so we do a lot of intensive training of our staff. When you have 700 employees, you have a lot of turnover. And so we're always training, always renewing certificates. Now we're starting to offer that to the broader community as well and other organizations. We also have rooms that can be rented for a number of things. So we're trying to lessen our dependence on governmental funding. As the Chief Development Officer, I'm charged with fundraising for the organization, and so we try any measure of things to do that. But I'll tell you, nothing's going to move the needle more than advocacy. Honestly, that's going to have the biggest impact. And so our executive team really spends a lot of time in Jefferson City working with our elected officials, getting them to come visit one of our client homes so they can really understand the issues that we face.
Well, I'll reiterate that also. One of the things that we are doing at the ministry, because we do have so many of our guests who have for years said, I don't vote. It doesn't do any good if I vote. So we have an advocacy team that is not going to Jefferson City, but is going to our guests and saying, this is why it's important for you to vote. This is a letter that you can write, or we will actually provide letters for them and have them read it to them and have them sign it, and then we mail it for them. So they are learning to have their voices heard, which is key, I think, in moving that needle. Not necessarily only our voices, but the voices of our guests. Our guests need to be able to share their story, because there is a stigma around poverty and low-income people that from a lot of perspectives, that these people, our people, deserve to be where they're at. They and they don't deserve to have nice things even necessarily. I was talking to somebody recently about some plans we have for the future, and they said, but aren't you worried about putting money into something that looks nice? And I said, poor people also deserve to have nice things. They should not always be relegated to the basement of a church. Poor people deserve to have nice things, and 99% of the time they are not poor because of their own circumstances. It is not a character flaw. And so to educate our broader community about the realities of who is in poverty, and it is your next door neighbor, and it is your family member It's people that you care about and that their lives matter regardless of what their pocketbook says, and that they should be valued simply for who they are. And so it's to me, it's part of it is giving our people voice, who feel like they have been silenced or that they didn't have a voice for so long, and empowering them to do some of their own work alongside us, and we walk alongside them on that journey. Other things that we are doing as a food ministry, we are really good at food rescue. We try to minimize the amount of best that we can be within our community, and serve the community. I like to think that we are the heart and hub of a community, or we should be the heart and hub of a community. And so we are working really hard to become that heart and hub.
Yeah. Brenda reminded me of the story of the blind man in the Gospel of John, 9th chapter, where the folks say, well, who sinned that this man is blind? You know, was it dad's fault? Was it mom's fault? And so if people are poor, first there's that assumption. Somebody must be sinning somewhere. And every person in poverty I've ever met was a sinner. I will admit that. But you know what? Every legislator I've ever met was a sinner. I am a sinner. Every member of Epiphany United Church of Christ that I go to church with is a sinner. We all make mistakes, but we're a lot quicker to be very, very judgmental of those who are in poverty and to blame their poverty on them. And when I started at RAL in 1991, I blamed poor people for not voting. Some of you have talked about that. But I came to understand why. You know, when you combine how hard your life is when you're trying to get to 2 or 3 jobs by public transportation, and there is no time to go vote, and we don't exactly we don't encourage people to vote by mail. In fact, you know, you're going to have to prove that you deserve an absentee ballot. We don't make it easy for people. And then if you're listening to the folks running for office, sometimes I say it's like Tweedledum versus Tweedledummer, because neither one of them talks like they understand anything about your life. You know, you ask them, how do you solve this? Oh, we need a tax credit. Well, a tax credit isn't going to fix certain things. A living wage job might fix some things, but we just don't have candidates who talk in ways that make people in poverty feel like they have any reason to vote for either of them. Now, we all know that sometimes it's about reducing harm, that one candidate will make your life better than the other one will. Maybe neither one of them are great, but there are differences, and we can help people understand that if we will work with folks. But it takes entering relationships so that you can have those trusting conversations to make that happen. We finally want to ask what can our congregations do to be supportive of each of your ministries at this time? And we'll start with you.
Okay, so I think first of all, I very firmly believe in the power of prayer. So prayers for each of our organizations, for our leadership, and then for the clients that we serve. You know, they're the ones out there who are really struggling and scared about how they're going to get medical care for their child that's sick, how they're going to feed their family, how they're going to have that safe housing. So prayers definitely can help. And then, as everyone else has already said, advocacy. Get out there, tell the stories of who these people are and why it's important that we are helping them and not leaving them behind and forgetting about those who are most in need in our society. And then donations. I mean, I think all of us are always more than happy to have any donations. So if a particular area of ministry that these organizations have really speaks with you, you know, go to our websites, make a donation, volunteer. If, you know, maybe you don't have the resources to donate financially, but maybe you have an expertise in an area, go to the website, reach out to us, volunteer. Hey, I'd really like to help. Here's what I can do. How can I help your organization? And those are probably the biggest things I think that would help right now.
That's one thing I would say right away is never hesitate to pick up the phone and call us. Don't assume you know what we need. Call and say, what do you need today? Or call and say, we want to do a food drive. What do you need in the next 2 weeks? Or call and say, we want to support some children for a summer program. What do you need to make that happen? Never hesitate to pick up the phone and ask that question. But please, I beg you, please, please, please do not assume you know what we need. Pick up the phone and don't hesitate to call.
So as an affordable housing community, we are also always looking for opportunities to create housing to help fill that gap that exists. And so that has looked like land partners with our UCC churches where affordable housing is built on property. And then we're able to manage that housing and, house people. I think something I'd also encourage is just to keep an open mind as we navigate this new territory. Our partnerships with our communities and our churches will look different. We might have to look at different ideas and unique pairings. And I think keeping that creativity and that open-mindedness really helps us grow and push forward and meet people where they are and meet the need in a really unique and caring way.
Yeah, I would like to just echo pretty much what's been said by the other panel members. I would ask you to pray for the clients that we serve and the team members who serve them. That's what I include in my prayers every night and every single morning. Donate. As always, any gift, there's no gift too small. We appreciate all the support. And then lastly, believe it or not, follow us on social media because many times we share our story on social media. So we're on Facebook and Instagram, and I think we even have a TikTok account. But we share a call to action for advocacy. There may be some pressing issue that's happening in Jefferson City or Washington, D.C., and as many others said, we'll provide you with the letter. We'll provide you with the talking points. I mean, we're going to make it as easy for you to help us advocate as possible. So those three things: pray, donate, and follow us on social media.
I'm going to take a little different approach. We are all CHHSM agencies, so we are all fingers and feet of the church. We are born out of you. And the church is also going through a transition. There aren't as many people in the pews. Our churches are aging. And so in addition to all of the things we need to do to reinvent ourselves, I think it is important for us to understand that congregations are in the midst of trying to reinvent themselves as well. And we need to do that in partnership. Mm-hmm. So for young people who don't want to sit in the lovely pews that we have and they want to do, I think it is upon us to create opportunities to be church and encourage members to come and get involved with what we do. For example, at Unleashing Potential, we were actually on a call with a couple of adorable sophomores from SLU today who want to do some social emotional work with our children. And so I was like, so are you getting credit for this? Or how much is this going to cost? And they were moved to want to do something for young people. There are tons and tons of young people out there. And for them, that's church. That's their spiritual growth. And we need to capture that as CHHSM agencies, as organizations that are serving those in underserved communities. And we need to work together because it's not always going to be the money that helps. For us, as we try to create like a day a month of day of play where parents and children can come together and learn, and I'm thinking off the fly, maybe we choose Friedens for the month of February. to help us to staff that. If members in your congregation see what we do, you'll be a better advocate.
Indeed.
Because then you have the personal experience of our ministries.
That's right.
So that's one way I think we can work together as children of Christ to do the work that we're all called to do.
Yep. Exactly, Darlene. When I started at Reform Organization of Welfare in 1991, we were a Catholic Campaign for Human Development organization. So over half of our board had to be people in poverty. So my bosses were people in poverty, and they taught me what's what. And so I became the advocate I am, not because I had book learning about public policy, but because I got to know people like Angela and Regina and Pat and just dozens of people. And I became convinced I will not let this happen to them. I love them too much to let this happen to them, because I saw what government policy and numbers that don't pay attention to the real cost of living we're doing to their lives. So it is in falling in love with each other, that we become good advocates. So that's what I would advise our congregations to do. How do you help people meet each other and fall in love? That's our job right there. Help people meet each other and fall in love. Go ahead.
And I would say we are all CHSM agencies, but we are all CHSM agencies representing real people.
Mm-hmm.
Everything we do is for people. And I think that is key, that Isaiah 58 Ministries doesn't work in a vacuum. We are working with people. We are building relationships. We are connecting with people, seeing people as individuals. One thing I've noticed as I travel the country and I've traveled the world is people are people wherever you go.
Mm-hmm.
It doesn't matter how much money's in your pocket. Doesn't matter what language you speak. People are people, and people are deserving of love and respect. And that is what CHSM agencies are really good at doing. Not only CHSM agencies, but we are really good at doing that, at recognizing the worth and value of each individual person. So,
yeah. Are there questions from those sitting here before me or anyone online while we have this wonderful panel of experts here?
Actually, I don't know if you all can hear me in the room, but this is Jamar from the
Oh.
CHSM office.
We'll come back to you. Okay.
Oh,
Go ahead, Jamar.
oh, okay. No, I just wanted to thank all of the panelists for the honesty and openness in terms of the impact that this moment is having on your programs. I know how tough uh, this moment has to be in terms of trying to administer a program, trying to keep things together, serve our clients when there's so much uncertainty and quite frankly, even uncertainty that begins to impact the staff, right? Because they see what's going on. And so, one, just thank you for sharing these stories. It's so important. And the question that I have, and it's kind of two-part. One, I was in a CHSM board meeting earlier today, and one of the things we talked about is that in this moment, and I know Andrew is on the phone, so if I miss something, please chime in. But one of the things that we talked about is how can CHSM as a national network offer support to organizations at this time? What would that look like in a meaningful way? Yes, we've been partnering with the UCC's DC office to try to do some advocacy and share your stories with them so they can get to the Capitol Hill and share with you all the advocacy alerts that they send out. But is there more that we can do, both as CHSM National as well as a network, right? What would that look like? And then I'm also wondering too, um, second part of the question, given that this is having such a detrimental impact on the clients that everyone is serving, um, how do we also support you all? Because I know that that begins to impact your staff. Um, it to see that sometimes what we used to could do, we can't do anymore. There were stories that were shared with us that, staff were needing to have, counseling because they had to tell people there was no food that they could provide to them. And so it was weighing on staff having to tell people no at this time of great need. What does that look like in terms of support? And how are you all balancing um, needing to, sort of keep the lights on and keep everything together, but then also do advocacy, right? It's two different things with a very small staff. You want to advocate and tell your story, but then there's also increased demand at a time when, resources are thin. How do you balance that, right? And again, how can we support at a moment like this? So, thank you for listening.
Well, thank you for joining us. Anyone want to respond to Jamar?
This is Darlene. I think maybe helping with some messaging for us, because we don't have a government relations consultant, expert, lobbyist. And so to create the messaging goes to my two-person development team or me. And we've all three of us are juggling a whole lot. So Jamar, maybe we can talk about each of our different ministries. And if the Chisholm staff could help create some talking points for us, that could be helpful.
Yeah. Any other thoughts? Okay, we were starting to hear from a woman in the audience here about Emmaus. We could take a mic out. That would be great. That would keep me from having to repeat it back. So
thank you, first of all, for coming and speaking to us, because I have been to worked with Emmaus Home. I've been to your learning lab, and what Darlene said about really getting into the place and learning what you do is the best way I think I myself can go out and advocate. And this is what I'm on Back Bay Missions, which is in Mississippi, but on the Chisholm Agency, and I'm on their board, but I also went there for a work camp so I could get in-depth learning of what they did every day. And I have a passion for that. And it gives me that wanting to get that message. She probably gets tired of hearing me talk about Back Bay Missions sometimes, but I appreciate what you're doing, but I think we really do need to get people down to your agencies and see what you do would make a big difference when they come back to their church as well.
I am probably the only person in this room who does not have a background to know what all of you are doing before I got here. So,
well, thank you for coming.
Because I am sort of driving this woman these days.
Okay.
Yeah.
All right.
One of the things that strikes me hearing all of your stories is how little I, as a person who sits in my congregation, even though I know Joyce and I know the things that she is very involved in and does, I don't know about I know Emmaus because one of our members is a participant in Emmaus. And I have heard you speak about the different programs on, the TV, on the radio show but I really don't know about all these things that you have been doing. I don't know about this place, which reminds me a lot of her Back Bay Mission, that it's here in St. Louis. And when you ask me what I might be able to do, what I think about is the advocacy I might be able to do if you sent me those things that you would like me to send off to somebody that you need right now, or that that would be helpful to to have more people say something about, okay?
Yeah.
In general, I've been concerned about SNAP. I've been concerned about all these things in general. But hearing your individual stories, it makes it more personal. Like you say, it is a person who is suffering. It is not, a policy that is, abstract and, you know, but it is a real person behind it. And that's what you guys are all dealing with, are the real people. And I think that if, somehow people like me can do some advocacy for people like you, that might be the way that we can help you.
My name's Marie Haupt, and I'm a member of this church, and I am very familiar with Emmaus. When I was a child, we used to go and sing and do plays and play baseball with the residents, and I'm very familiar with them, and I've heard of the others, but haven't been personally involved. Our church, at the first Sunday of every month, we do what's called noisy offering, where our children go around and collect change. And then we educate the children on whatever charity it is. I know Emmaus has been one. And I think that would be a good thing for us if I could get information from you all, like a business card or something where I can look it up online and we can reach out to some of the other charities. We've just been doing the ones in St. Charles, but I'd like to see them extend. Also, is there chances that we can have our young people come visit or get something like go there and see what goes on? Because I know as a child, when I went to Emmaus, it made a big impact on me. I didn't realize there were people like that, So that for our church, I would like, before you all leave, give me a business card or something, but I would like to get our young people more involved. And I think it makes them more compassionate and it educates them on, it's not just people like in our congregation or at their schools, it's others. So thank you for coming. It's been quite educational for me. I appreciate your attendance.
Any responses to the folks who spoke a moment ago?
I think one of the things I realize with us as many of us as CHSM agencies, is we are very small organizations. I always thought, because when you're comparing yourself to senior housing, necessarily I feel like a tiny little blip on a screen. But I mean, we really are small, at least the ones up here, we're pretty small organizations. And so, Jamar, to your point, or what could CHSM do? I do think helping to get our word and our stories out to the broader UCC communities is important, because yes, a development team of 2 or 3, we have our hands full, and so to be able to share the story more broadly, I think would be very helpful to us, so that more people do know about Isaiah 58 Ministries or Emmaus House or IFM, all of these different agencies that we don't have the capacity in our overwhelming world right now as it is to take time to speak those words to power. So to be able to help us coordinate messaging that reaches the broader world, I think is important.
Yeah, I love the noisy offering idea. We do that at Epiphany. We made St. Louis Area Food Bank our we do it a quarter at a time, 3 months at a time. And when we saw that the SNAP cuts were coming back in the summer, we voted to do the food bank, and then we didn't know the government was going to shut down. So I feel like the Holy Spirit was at work saying, do the food bank, you know. And then we also, I think, have just collected 250 cans of corn or something like that for Isaiah 58. We're doing some of the things that you've named out there that I think are important. I want to share that the United Church of Christ does already have a wonderful advocacy network, the Justice and Peace Advocacy Network, that you can just go to ucc.org and Google Justice and Peace Advocacy Network and get signed up for their newsletters. And they will send you, hey, Congress is about to do X, send off this letter. They'll give you a sample letter. It will be more effective if you will edit it so that it's in your own words. So I always change the subject line just a little bit, and I change, some of the paragraphs still around to how I would say it. I put it in my Southern drawl, and it works better that way. Because if they all look the same, they kind of ignore them. But if they think, oh, this person took time to write me, then they pay more attention. So do that. And so for national issues like HUD and for housing and SNAP and Medicaid and Medicare, things like that, the United Church of Christ is going to give you some really great stuff to do. For Missouri issues, I would recommend Empower Missouri, where I used to work. It's the old Missouri Association for Social Welfare. They do a great job covering state hunger issues and state housing issues, and also community justice issues, what used to be called criminal justice issues. And they currently have a campaign called the Clean Slate Campaign to help folks that were formerly incarcerated have their records sealed, because that record of the fact that you went to prison maybe for some low-level thing involving drugs when you were younger or whatever can keep people from getting jobs, can keep people from getting to educational programs or getting housing. And why would we give you a life sentence? I mean, you've served your time. Shouldn't when you're done with your time, shouldn't your time end? And you'll be able to go on with your own life. So they have a Clean Slate campaign going on right now, and a number of other important things to address some things that I oppose the death penalty in general, but there's some ways that the death penalty is administered, like that if there's a deadlocked jury, a judge can still sentence you to death, which is not a sensible kind of policy. They work on some things like that. So I highly recommend them to you, empowermissouri.org. Two great resources if you want to do, click on it and send a letter, kind of advocacy that will send it right off to your senators, your representatives, et cetera. Eric.
Yeah, a couple things that are in the chat that I want to just make sure everybody in the room is aware of. I got to backtrack a little bit here. So kind of, first of all, Darlene, when you mentioned trying to get together, when you did your shout out to Jamar there, he said, let's plan on early 2026. So hold him to it. Yeah. And Cindy Bum said, this is such a difficult time, but even though some of your organizations weren't around during the Depression, all of you survived the pandemic. God is with you then and is with us now. And one of the things that's been discussed here largely is advocacy. And Andrea put here in the chat, maybe we could have a nationwide advocacy action alert system, a way to help people in the pews to know what the CHSHSM agencies need them to communicate to their legislators, much like you were asking for, but also used as sparingly as possible so folks actually continue to participate in it. Jamar said we can do that in partnership with the DC office, and this is in response to you, Darlene. Make that happen quickly in terms of the talking points you were discussing. And here's one thought that I had that Cindy Bum is also resonating with, is that I think you had mentioned that you haven't heard about a lot of this stuff, and I think we clergy need to be better about connecting the dots between our CHSHSM agencies and our congregations and our conference, because you are us and we are you. Like Darlene said, you're what, the feet and fingers? Is that what you said? Fingers and feet of the church, and you do so much on our behalf and with us. And it's one of the things that I love about our United Church of Christ and our conference is all these covenant partnerships that are lived out that make such a remarkable difference in in real people's lives. And so I have a real depth of admiration and gratitude for all the work that all of your agencies do and the agencies that aren't represented here tonight. But what Cindy says is Missouri Mid-South, there are some lessons here. Association boundaries are being crossed, thank God. And the reason that many people don't know about some CHHSM organizations is because they're in the St. Louis Association rather than the Eastern or Western, I would say. We need to get all the stories out to all the MMS UCC family.
Yeah.
And Jamar said, I would love to strategize with the Missouri Mid-South Conference in ways we can get the word out about CHSM agencies in the area and highlight your stories to churches in the conference and beyond. And then there's more information about the Justice of Peace Network. So that was a lot of information in a short amount of time, but there it is.
All right. Anything else we want to do tonight? Concluding remarks from the panel? Anybody? Thanks for listening. All right. Well, we'd like to thank you all for bringing your expertise to us. And shall I lead us in a prayer?
Well, thank you too so much
you're welcome.
for being here and leading this discussion. I appreciate it. So
I was glad to be with these good folks.
But yeah, please, if you would.
All right. Let us pray. Loving God, we thank you for these folks who every day serve your precious children who are struggling with the most basic of human needs. We pray that your Holy Spirit will enliven them in the long days that they face, that they will have the colleagues that they need in order to each take rest when they need to take rest. And we pray that hearts will be changed. As my wife Dorothy frequently prays, may the hearts of the elected officials be broken by the things that break your heart, God, so that things can change. We pray that we'll listen to those who are personally impacted and recognize them as our beloved siblings. And may we fall in love with each other and make sure that each one has what is needed. In your name we pray. Amen.
Thank you for joining us on Zoom, everybody. Have a good night. If you're here, cookies downstairs.